My name is Dr. Elizabeth Klodas, and I'm the Director of Preventive Cardiology Consultants in Edina, Minnesota. Heart disease is the #1 killer and disabler in the United States for both men and women, and yet it is predominantly preventable. The things you can do to prevent heart disease in yourself are actually quite simple. Number 1, exercise every day. Move your body through space. Make it a part of your day, just like brushing your teeth is or getting dressed. Make it a routine. It doesn't have to be extreme or particularly hard. Anything you like to do. Walking, swimming, riding a bike, gardening, just as long as you move your body through space for a minimum of 30 minutes a day. From a food perspective, choose fresh ingredients. Think fresh fruits and vegetables, whole unprocessed grains, fish, nuts, and seeds. For fats, always favor liquid fats that are liquid at room temperature, so olive oil, canola oil, the oils in nuts and seeds, oils in fish, avocados. Those oils are full of omega-3 fatty acids, which are very beneficial for heart health and actually even help prevent cancer and other inflammatory disorders. For grains, again, whole grains. Choose carbohydrates that are closest to their original form. So when you're eating rice, think brown rice or wild rice. When you're eating pasta, think whole grain, whole wheat pasta. When you're eating bread, pick the densest, most sawdust-like bread you can still enjoy, and eat a little less of it. Think about an open-faced sandwich as opposed to 2 pieces of bread with your sandwich meal. Think soups. Think ways to incorporate vegetables and fruits into your diet. Avoid saturated fats, fats that are solid at room temperature and come predominantly from animal sources. So the marbling in beef, the fat in chicken, those are fats you should really try and limit in your diet. You don't have to completely avoid them, but try and balance those with more fruits and vegetables on your plate. The fats that should never cross your lips are the trans fats. Those are fats that have been artificially modified to be solid. You can tell that a product has trans fats in it if you look at the label and you see partially hydrogenated or hydrogenated fats listed anywhere in the ingredient list. Those are items you should put back on the shelf. For proteins, it's really not an issue in terms of which protein you eat. Beef is fine, chicken is fine, again, in smaller quantities. It's the means of preparation. So, broiled, steamed, grilled is fine. Fried, not as good a choice. Beverages, we often forget about how we take in calories and nutrients through the liquids that we consume. Water, unsweetened tea, terrific. Herbal teas, black tea, green tea, very high in antioxidants and heart healthy. Actually, even coffee has been shown to be high in antioxidants and beneficial for the heart. But remember that black tea, green tea, and coffee can be high in caffeine, and that can have its own series of side effects. So moderation is always key. But don't mix your beverages in with other things. Don't put sugar and sweeteners into your coffee. When you're drinking pops, at least choose the diet forms, because sugar adds a lot of calories without any nutritional benefit. Alcohol in moderation has also been shown to be beneficial for the heart. As a physician, it's difficult to recommend to folks that they go ahead and start drinking. But it's important to know what the definition of moderate alcohol intake is. Moderate amounts are 1 to 2 alcoholic beverages per day, 1 for women or smaller individuals, and 2 for men. 1 drink is considered to be 5 ounces of wine, 1.5 ounces of liquor, or 12 ounces of beer. You should also get to know your numbers. Although lifestyle is very important, and everything that you do towards living better, eating better, exercising more has absolute payoffs in terms of your general health, you also need to know your numbers. And the numbers that are important to know something about are: what is your blood pressure reading, what are your cholesterol readings, what's your weight and height ratio, and or BMI, and what is your blood sugar reading. So blood pressure first. Normal blood pressure is defined as anything under 120/80. High blood pressure, hypertension, is defined as any reading of 140/90 or above. If you're seeing readings persistently at or above 140/90 at your doctor's office, get involved. Ask what you can do to help bring those numbers down, how you can change how you're eating or living your life, and see whether you can get those numbers down on your own without medications. Many people do require medications to control their blood pressure, and it's important to continue to take those medications and keep your blood pressures under control to really reduce your risk over the long haul. For cholesterol, although most people remember their total number, that's actually one of the least important pieces of data you get when you have your cholesterol profile checked. The total number should be under 200, but it's the components that make up that total that are far more important total value. So, the total cholesterol is made up of good cholesterol, bad cholesterol, and triglycerides. The good cholesterol is HDL. It's the happy cholesterol, and you want that number to be as high as possible. This is cholesterol that's not depositing in your arteries. It's actually on its way out. So you can think of it as being on a garbage truck leaving your body. So you want that number as high as possible. In men, we like to see that number over 40. In women, especially if they're premenopausal, we like to see that number over 50. Low HDL cholesterols are anything under 40, and especially if they're below 35. That's a significant risk for long-term development of atherosclerotic deposits or hardening of the arteries, plaque. LDL is the bad cholesterol. If HDL are the garbage trucks, LDL is the garbage. This is what's potentially depositing in your arteries, and you want this cholesterol number to be low. LDL is lousy. You want the number low. For most people, we like to see the LDL cholesterol below 130. As you accumulate risk factors, which include smoking, high blood pressure, family history of heart disease, excess weight, inactivity, poor diet, we really want to see that number even lower, closer to 100. Once you have documented coronary or vascular disease, so once you've had an angioplasty or stent placed, if you've had bypass surgery, if you've experienced a stroke, we really like to see the LDL below 70, because at those levels we have found that we can actually stop or even reverse some of the deposits. So it's very important to get those LDL levels down. Triglycerides are more of a fatty particle in the bloodstream. Only 1/5 of the triglycerides is actually made up out of cholesterol. So that's why you can't add triglycerides plus HDL plus LDL to get the total. The formula is actually HDL plus LDL plus 1/5 of the triglycerides. Triglycerides in and of themselves are not particularly problematic, although they tend to signal problems with lifestyle frequently. So if you're not moving your body, if you're eating poorly, if you're overweight, your triglyceride levels will go up. Normal levels are considered under 150. If they're over 400, that can be a health risk in its own right, not even associated with coronary disease. And if you have very high triglyceride levels, you really do need to be on medications and follow that up closely. Another number that's important to have a sense of is your blood sugar level. A normal blood sugar number is under 100. Levels above 126 on multiple occasions in the fasting state are consistent with the presence of diabetes. Diabetes puts people at very high risk of developing heart disease, stroke, vascular disease, so it's a big deal if your blood sugars are elevated. Numbers between 101 and 125 are known as pre-diabetes. They're still associated with an increased risk of all those things I just mentioned, just not as high as if you have full-blown diabetes. But if your blood sugar levels fall in between this range, and I'm talking about fasting blood sugar levels, you should make every attempt to see what you can do to get those levels into the normal range. It's again going to be very dependent upon what you eat, how much you weigh, and how much you exercise. It all really does come back to the basic notion that we are what we eat, We are going to be as healthy and fit as we allow ourselves to be, and our weight is really dependent upon calories in versus calories out, as well as the quality of what we take in. If you look at all the risk factors that contribute to heart disease, there are some we have no control over, there are some that can be helped with medications, but there's a lot that are purely under our control. So what don't we have control over? We don't have control over our age and our genetics. We have a family history of heart disease. That puts us kind of behind the eight ball, and we have a higher sort of threshold to reach in terms of all of our lifestyle efforts, because we have a negative factor in our profile that we can't do anything about. Blood sugar, we can do something about that with medications. High cholesterol or cholesterol abnormalities, we can do something with about that with medications. We certainly have plenty of medications for high blood pressure treatments. Smoking is primarily under your control. How much you move, how you eat, and what your weight is are entirely under your control. And all of those risk factors, the ones that are purely under our control, are just as important as an LDL level or a family history of heart disease. So if you're doing everything right from your side, your risk is decreased. Even if your LDL is still not perfect, even if you have a family history of heart disease. That's why lifestyle is so very important to preventing this #1 killer and disabler.